Hi, I'm Dr. William Goldman. I am a psychiatrist in Southlake, Texas, and I'm here to talk about ketamine today. If someone has treatment-resistant depression and they're interested in contacting my office, we have them set an appointment and give them a couple of weeks to gather their prior psychiatric or medical records, which would show what prescriptions they've been on and for how long and what diagnosis they were given and what other treatments. Because I want to use that at our first sit-down visit to do an evaluation, looking deeply back through previous treatments and previous hospitalizations and previous medications to find out if they do meet criteria for treatment-resistant depression or if it's something else that is either complicating it or masquerading as treatment-resistant depression. In addition to figuring out if they do indeed have treatment-resistant depression, I'm also going to figure out if there's anything they have going on medically or otherwise that would make them not a candidate for ketamine, because not everybody is. And once I've determined that yes, they do have treatment-resistant depression and are a candidate for ketamine, we then set up another appointment with them. And my appointments for ketamine treatment itself tend to be about an hour. And what I do is have people come in. They have to bring someone with them that can drive them home afterwards. Instead of doing an intravenous infusion, which a lot of these ketamine clinics nationwide are doing, usually run by anesthesiologists, what I do is an intramuscular injection, a shot in the arm with ketamine, the same ketamine that's being used by anybody else. And then while they sit there in my office, I am there in the room with them. I'm observing them. I'm monitoring their blood pressure, their pulse, their oxygenation, everything. And over the course of that hour, people generally find that they get into sort of a trance-like or dissociative state. They do not feel high, they do not feel euphoric. This usually lasts about 20 minutes and then starts to fade for the remaining of the hour to the point that by 40 minutes into it, they're pretty clear mentally, but they may have a little double vision or wobbly balance or something like that going on. And at the end of the hour, after I've been monitoring them and documenting their progress, they're usually ready to get up, walk home, or walk to the car and get in the car and be driven home. And they can go and do anything they want the rest of the day. They can go have dinner, they can go out, they can go see a movie, go hang around the house. It doesn't matter. Their ketamine is clearing their system by that hour, hour and a half afterwards. That would sort of describe a treatment plan. Now, going forward with that, what do I do? Most studies show that ketamine loses its effect within about a week of the initial treatment. So when patients start feeling their depression returning, and they will, I've decided that it's about every week is what I want to give a treatment. And I do that for 3 to 4 weeks in series. Other people have other protocols. To each his own. There is no defining protocol or studies that show ketamine needs to be given at this amount, this number of times, over this course of time. What is known is ketamine is good at jump-starting someone who's deeply depressed, getting them to feel better. Then you'd like to maintain that with at least several sessions of ketamine. But then the question becomes, what do you do after that? What do you do a month later, 2 months later? It seems like what we want to do is find a medication that then works. Ketamine perhaps makes someone more likely to respond to a medication they'd tried previously or hadn't tried previously, so that they can maintain their non-depressed status over the course of time using medication. Ketamine is not to be done every month for the rest of your life or every week. It is something that is, during a defined period of time, you're getting someone out of their deep depression and into a more functional state, and then trying to find a medication that can be used to then maintain their remission status from depression. Recurrence may occur just like it can occur in any kind of depression, but then you deal with that as it comes along because you don't know if that's going to be months down the line or years down the line. And that's the case for all psychiatric disorders, not just treatment-resistant depression.